In this INR number 53, we are going to discuss a very important high yielding topic, which is cluster headache, which was the INICT question also. So, what is cluster headache? Cluster headache is a unilateral headache which will last for 15 minutes to 3 hours. Remember, it is a unilateral. So, you can see unilateral periorbital headache which will be lasting for 15 minutes to 3 hours, and it can be repetitive, right? And more commonly, who will be affected? Males are commonly affected. And what will be the common presentation? They will be having excruciating periorbital pain. Remember, excruciating periorbital pain, which will be unilateral. So sometimes it is also described as a suicide headache, right? With autonomic symptom, they will be having autonomic symptom. What are the autonomic symptoms? So along with periorbital unilateral headache, they will have autonomic symptoms. As you can see, this is the conjunctival injections or lacrimation or even rhinorrhea, right? So you can see rhinorrhea. So conjunctival injection, lacrimation, rhinorrhea, or maybe having Horner syndrome, which is consisting of ptosis, meiosis, and anhidrosis. You can see drooping of the eyelid, then constriction of the pupil, and less sweating at the skin in this area. This is called Horner syndrome. So cluster syndrome, unilateral periorbital headache, which will be a suicidal type of headache, and in this you can have autonomic symptoms in the form of conjunctival injection, lacrimation, rhinorrhea, or Horner syndrome. So what will be the treatment in acute cases? To abort the pain, you have to use sumatriptan injection, subcutaneous or nasal spray. Oral treatment has no role in the treatment of the cluster headache. Zolmitriptan nasal spray we can use. You can use 100% oxygen, and there is a NVNS, non-invasive vagal nerve stimulation. This is the FDA approved treatment for the cluster headache, for episodic cluster headache. This is the point given in Harrison 21st edition, right? So if you check the table of Harrison, you will find this point. Non-invasive vagal nerve stimulation, in the table it is given below, that it is used for episodic cluster headache. What is the prophylaxis? For prophylaxis, we can use verapamil and lithium. So this was a topic which came in INICT 2021. So keep revising this topic for your FMG NEET PG exam also. My best wishes for your exams.